boy. So this is a news story that it's pretty sad. And I want to make sure that I cover this today because I have somebody that is disabled that is more privy to the healthcare system, the sick care system, I should say, than some others. This is something that I think people need to realize. And we're at the beginning of 2023. It's January 3rd. So let's see this report really quick.
Tonight, the CDC is warning of an alarming surge in diabetes in coming decades among Americans under the age of 20. Treating the disease with insulin can be very expensive. And in our series, Side Effects, Gotti Schwartz looks at why a cap on prices in the new year will still leave tens of millions behind.
If you caught sight of brothers Owen and Thomas Gibson playing ball, chances are you'd never guess their pockets are constantly stocked with medical supplies. But as some of the 1 in 10 Americans with diabetes, just opening their family refrigerator is a constant reminder that life and insulin comes at a frustrating price.
It's not like this is new, right?
No, it's never changed. The patent was sold for $1 1 century ago. And since then, nothing's really changed. It hasn't gotten better. It's just getting more expensive.
As inflation rises, insulin prices in the U.S. remain by far the highest in the world.
We are definitely seeing people living with diabetes ration their insulin more than they've ever been.
And how dangerous is that?
It's incredibly dangerous. I mean, you are dealing with people's lives.
For years, some have chosen to head across the border to buy insulin in places like Mexico. Like this group we accompanied in 2019. But this year, there was hope that all that could finally change with the Inflation Reduction Act and talk of a nationwide cap on monthly insulin costs. When the legislation goes into effect in January, there will be a $35 a month limit on what patients pay out of pocket for insulin, but only for those with Medicare. The Gibson brothers are among an estimated more than 21 million being left behind.
When you heard about the Inflation Reduction Act, and then you found out that that relief seems to have an age to it, what went through your mind?
I'm so angry. It's exhausting. Just getting your hopes up, thinking, wow, maybe now we'll see a change. I just feel like we're being completely taken advantage of. You know, we don't have other options. On average, in a year, we're over $20,000.
You guys are over $20,000 in out-of-pocket expenses, and you're saying you're lucky because you guys have insurance.
We're not the worst off. We have insurance. There are people who don't. And that's really scary because those people have to make hard decisions. Do we buy insulin or do we pay rent? But it doesn't always seem that far off.
A constant fear shared by millions of other families dealing with diabetes every day. Gotti Schwartz, NBC News, San Diego.
Tonight, the
So apparently, according to the Inflation Reduction Act, people who do not receive Medicare or Medicare Part D, particularly people who are seniors, are the ones who receive this insulin cap. For people who do not have it, they either have to have private insurance or come out of pocket directly for their insulin. While it's good for people who are on Medicare, I'm happy because my mother has diabetes and now she'll have a cap on her insulin, which I'm glad because that will have, save her. But what about the people who have type 1 diabetes? What about the younger people who are under the age of 65, who aren't under the label of disabled, who have diabetes? What about them? Who have to get their insulin every month? What about them? It's crazy to think that a drug that was sold by, the patent was sold for $1 because the scientists that invented it said this should be for everybody to save their lives. It was only sold for $1. And now these companies are making billions of dollars off of it. Off of something that is life sustaining. This is one of the reasons why I say that we need to have a nationalized healthcare system. Health equals wealth. Health equals wealth. That's why I titled this video the way I did. Stolen health, stolen wealth. Same thing. Stolen health is your stolen wealth. And you're constantly having to slave in order to maintain something called your health. If you don't, you die. And so this is what I mean. Now your health is literally being stolen. And it should not be just limited to people who are over the age of 65. Why aren't people who also need insulin, who are younger age, not able to get it? Because that's how they did the Inflation Reduction Act. They did it through budget reconciliation, right? In fact, let's talk about that. Let me share my screen. This headline is the Inflation Reduction Act caps costs for Medicare patients on insulin, where the push for broader relief stands. This was at August of this year. Key points of Inflation Reduction Act caps monthly insulin costs for Medicare beneficiaries. The change will be meaningful for senior patients who struggle with the cost of treatment, but it excludes other patients. So the new legislative package signed into law by President Joe Biden on Tuesday is a big win for Medicare patients who struggle to cover the cost of insulin to manage their diabetes. But the bill, called the Inflation Reduction Act, falls short of applying those cost controls to the broader patient population who rely on insulin. The bill limits insulin copays to $35 per month for Medicare Part D beneficiaries starting in 2023, which is now. Notably, seniors covered by Medicare also have a $2,000 annual out-of-pocket cap on Part D prescription drugs starting in 2025. Medicare will also now have the ability to negotiate the costs of certain prescription drugs. But the changes fall short of the broader applicability to diabetes patients who are covered by private insurance. So Democrats pursued the Inflation Reduction Act through a process called budget reconciliation, or a simple party majority. In that process, the Senate parliamentarian, remember the rotating villain, people? Remember rotating villain? Senate parliamentarian ruled, an unelected official ruled broader insulin reform for non-Medicare patients could not be included in the legislation. You don't mean to tell me, that someone who is a non-elected position can rule and say, nah, you guys can't have it. Meanwhile, if they wanted to, if Kamala Harris wanted to, she could literally fire the parliamentarian or overrule the parliamentarian and then push it through and force it through. She could have did that. Hell, the Republicans did it. According to the rules, they could do it, but they didn't want to. And so they allowed the parliamentarian to call roughshod over the lives of people who are under the age of 65. Senate lawmakers then sought 60 votes in order to keep it in the bill, but they fell short with just 57 votes, as 43 lawmakers opposed it. They have 57 votes. They only needed 3 more, and it would have passed. It would have been included for everybody. So the American Diabetes Association plans to continue to advocate for relief for more patients, including the Insulin Act, which calls for capping monthly insulin costs for a broader patient population. The high cost of insulin result in 14% of patients having catastrophic levels of spending on the treatment, according to recent research from Yale University. For Medicare patients on insulin, catastrophic spending affects 1 in 5 patients. 1 in 5. So really, it's like, what else is new? And here's the funny part. You complain to Democratic politicians about it, but the parliamentarian, I'm sorry, the parliamentarian, they got in the way. Oh no. Oh no, the parliamentarian, we can't do anything if they block it. Oh, they're an insurmountable object, the parliamentarian. Tell that to a 39 or 40-year-old that dies because they had to ration their insulin. Tell that to them. Tell it to their family. But the parliamentarian. My heart goes out to anybody that has to deal with diabetes, number 1. Number 2, my heart also goes out to people who are under the age of 65, that this will not help. Who don't have Medicare, my heart goes out to you. Because instead of getting relief, you have to deal with this. Let me... And I got more, but let's go to Hen's Teeth says, our health don't care systems is full of special exceptions that allow for a few people to get what they may need. That is also true. Does RBN have a playlist that goes through all of Biden's wins that liberals love to spout? No, we don't have that. V.S. Adams says, why just Medicare? Because number 1, the government only has control over Medicare. Number two, if you make a law for insurance companies to cap their cost on their recipients to only $35, then that means more money that the insurance companies have to put out, which means that they're going to gripe about it. They don't want to put out more money. Their goal is to spend as least money as possible. So that's why it wasn't done for the insurance companies. There could have been a law that says, oh, all your insurance companies, any private insurance company also has to cap their insulin costs at $35 a month. They could have also put that in the bill, but guess what? They didn't, because the insurance companies are in the pockets of politicians, and the goal for them being in the pockets of the politicians is so that they won't spend more money. That's what it is. Raziel the Great says, I say just take some of that tax money this year and buy some healthcare stocks, get a dividend check, and let the insurance companies pay you. Unfortunately, people don't have enough money for that. Ilhanor says, my brother died on Thanksgiving this year. Oh my God. I'm so sorry. My brother died on Thanksgiving this year from pancreatic cancer because he couldn't afford to have health care for most of his life, so they couldn't catch the cancer until it was too late. This is why we talk about what we talk about. You know how, and this is kind of going along with what, and I'm very sorry about this happening to you, Ilhanor. My condolences to you. But I just want to take what you said, and you brought up a point for me. You know how when people say, oh man, men, they just don't go to the doctors like they should, which we just don't go to the doctor like we should. But you know why? Part of the reason why is because we don't want to spend that much money. Because it's expensive. So number one, we don't go to the doctor like we should because, well, we just don't. But another reason is because it's expensive. It's money. And we're like, we can't afford that. And so guess what? We just forego going to the doctor. And so then the only time we ever go to the doctor is when an emergency happens. And by the time it's an emergency, it's too late. Because no preventative care was done. No close monitoring. Technically, you're supposed to have a checkup every 6 months. You're supposed to go to your primary care doctor and get a checkup every 6 months. Get a physical, get your blood tests, things like that. So you can catch things early, because if you catch things early, then you can combat it and things won't happen to you. But because we can't afford it, guess what? Then it lingers for too long, and then guess what? You have an emergency on your hands, and it may be too late. And that is the issue that we face in this nation. And again, I'm sorry, to you, Ilhanor, that, oh my gosh. Creative Experiment says Chomsky said Biden is better than Trump, though. Maybe for old people. Not even for old people. It's just for the people. It depends on the class of the old person. Because poor old people, Biden's not better for them. For rich old people, Biden's great. Yeah. V.S. Adams, you never heard of the Senate parliamentarian before? That's by design. That's by design. You see, the thing is that when they try to get a simple majority in order to vote for something to make something pass, then guess what? They can call for the Senate parliamentarian in order to overrule things. And the Senate parliamentarian is a unelected official that can either go this or this for laws. Where's the democracy in that? By the way, the Senate parliamentarian could be either overruled or fired. And yet they allowed the Senate parliamentarian to continuously do it, to say yes or no to important things that actually help those of us who are the American people. And so you don't know about it until it's convenient for them to bring it up. Why didn't you guys pass the bill? Oh, well, it's like you guys had the numbers. The Senate parliamentarian, they say we couldn't do it. Sorry. Meanwhile, the capitalists that are putting money in their pockets are going, yes, blame it on the parliamentarian. Here's a few dollars. Go ahead. So then we don't get things that we need as a people. The politicians get to keep their jobs because they're actually getting paid by the corporations and the billionaires and the ultra rich. And then they keep their seats. It's a money game, baby. That's what it is. Jen Mom. Kamala Harris is busy hiding. Miss Kamala do not come Harris. Jay Burke says the system is designed for us to suffer so the rich class never have to know what it is. True. Oh boy. Sad. Very sad. Now I have another article to read. And oh boy. Oh wait. That's not what I wanted. Pay me what you owe me. Better have my money. Okay. You thought that I forgot? All right. This is going to be an interesting article. If y'all do not... Oh, by the way, that last video, shout out to Case Study QB. I forgot to shout him out. I'm sorry. Case Study QB, shout out to that video about the insulin prices. Thank you so much for that. But New York University Emergency Department prioritizes the wealthy for treatment. Interesting, right? This is yesterday. Eric Schreiber, great reading, says New York University's Ronald O. Perlman Center for Emergency Services prioritizes wealthy donors. Surprise, surprise, surprise. Politicians and celebrities for treatment at the expense of everyone else. According to an extensive investigation by the New York Times, dozens of doctors and other healthcare workers report that administrators pressured them to treat rich and influential patients immediately for minor complaints, thus forcing patients with potentially life-threatening conditions to wait for urgently needed care. Oh my goodness, these countries that have universal health care, you're put on a waiting list. You have to wait. Oh my God. You guys have to wait for universal health care. Oh gosh. This practice, which is not unique to NYU, violates the principle of medical triage in the operation of emergency departments. Under this principle, the sickest patients receive treatment first, without regard for their ability to pay for care, and patients with less serious presentations wait their turn. More fundamentally, NYU's discriminatory practice illustrates that the provision of healthcare is dominated by social inequity and the profit system. It gives an example. It says, when Kenneth G. Langone, a billionaire and founder of Home Depot, came to the NYU emergency department with stomach pain in September of 2021, he was quickly treated in a room that ostensibly is reserved for patients in critical condition. Langone is chair of the hospital's board of trustees and has donated hundreds of millions of dollars to NYU's hospital system. Langone's symptoms were associated with a bacterial infection. You want to get to the front of the line at the hospital? Just be on the board of trustees, be a billionaire, and donate hundreds of millions of dollars to us, and we'll put you in the front of the line because your life matters more than other people's. Your life matters more. You spent more money. You gave us more money. So guess what? Then you get put to the front of the line. Oh yeah, that person that's experiencing cardiac arrest. Oh, we don't need to focus on them. They're small potatoes. Oh, I'm sorry. You got an ingrown toenail. Oh, come here, you poor thing. Oh, thank you so much for that $100 million check. Oh, man. Is that a rash? Okay, we'll get that taken care of you real quick. Oh, you're over there suffering from kidney failure and you need dialysis. You sit right there. You wait your turn. America's the greatest country in the world. For whom? For whom? Please. Let's continue. Oops. I did not mean to do that. I took it away. Please don't go away from me. Okay. All right. Another example. In spring 2022, Democratic Senator Chuck Schumer of New York brought his wife to the emergency department when she had a fever and was short of breath. Schumer and his wife were rushed into a room and tested for C19. Meanwhile, sicker patients were being treated in the crowded emergency department's hallways. On occasion, a well-known actor with a headache and low-grade fever was placed at the front of the line for a CT scan. Dr. Michelle Romero told the New York Times. When the actor demanded a spinal tap that Romero thought was unnecessary, a supervisor told her to perform it anyway. The test results were normal. The actor was treated ahead of a patient from a nursing home who had possible sepsis and had been waiting 3 hours for treatment. Yo, in 2019, I almost went into septic shock. That is not fun. I almost went into septic shock. I was in the ER. I was in the ICU. I think 4 days, 4 days in the ICU. They put a central line and an A line in me. And you mean to tell me you have an older gentleman that has possible sepsis? Wait. What did you say? He had possible sepsis. And this actor had a headache and low-grade fever. Some Tylenol would have helped that. He had headache and low-grade fever. You know what you do for that? You take some Tylenol. You want it a little stronger? Get some extra strength. Extra strength. Go by your local 7-Eleven or Wawa and go and get it. You had a gentleman in there that was an older gentleman from a nursing home who had possible sepsis, and he gets skipped? Are you kidding me right now? All because this person is rich and is a well-known actor. NYU's discriminatory treatment begins before the patient even arrives at the facility. This is telling. It says the emergency room has a trustee access line. A trustee access line that donors can call to notify the hospital that they're on the way. Once alerted, administrators notify doctors through texts and emails that a high-profile patient is coming. The doctors understand the implicity that they are to give the patient priority treatment. Moreover, they fear the professional consequences of not doing so. If you don't treat this person and put them to the head of the line, you are fired. And you'll never work in this town again. If you don't put this person at the head of the line, even though their symptoms and their condition is less severe than other people who may be poor. Stolen health. Stolen health. This is exactly what it is. And a lot of times people will go, well, we need Medicare for all. I'm like, no. We need Medicare for all is too weak. It's too weak. I'm sorry. I know people are like, we need Medicare for all. No. We need further than that. We need a full nationalization of our healthcare system. Because even if we have Medicare for all, this will still happen. Even if we have Medicare for all, guess what? The people who also donate to these hospitals will still get preferential treatment. But if you take all that out, if they're just all nationalized, there's no need for these rich people to donate to these hospitals, to be on these board of trustees. So thereby, if there's no need for them to have all these donations go to the hospitals, guess what? They get treated just like everybody else. Because the profit motive is no longer there. There's no longer a profit incentive. So now you have people being pushed back to the back of the line who may be more severe, who are literally dying just because they actually want to treat somebody who's more richer, who may not need it as badly. Health is your wealth, and it's being stolen from you. And in case the message is somehow missed, the electronic medical charts, your medical charts, point out that certain patients have donated to the hospital or have a relationship with one of its executives. A screenshot of one record from July 2020 that a doctor shared with the Times read, quote, major trustee, please prioritize, end quote. Workers report that they have been pulled from sicker patients to attend to wealthy patients with minor complaints. So imagine that you are a tech or a nurse and you're tending to a patient who has a more serious condition, and then they say, leave that person that's more sicker and go to this person that's more wealthy and tend to them instead. Is that fair? Is that fair? Is that just? Quote, it didn't matter how busy it was, a VIP was coming and we had to drop everything. Dr. Uche Blackstock told the Times. Blackstock left the NYU emergency room partially because of her objections to this discriminatory practice. And then this part talks about how the ambulance is told to bring patients to Bellevue instead of NYU because they don't want to service anybody who is poor at NYU. So they take them to Bellevue, which actually services more poor people, even if that person is closer to NYU. And it talks about these hospital executives getting millions in compensation. I'm going to share the links for this article is also in the description. But for people to sit here and go, our healthcare system is better, that is absolutely, people just don't have a grasp on reality. They don't. How in the hell are you going to treat this like it's a restaurant when you have some big name person come in? I used to work in a restaurant called NBA City back in the day when I was in the industry. I was a line cook. And I remember when Dr. J came in. Dr. J came in to eat at the restaurant near closing time. And we were basically closed, right? And he wanted a milkshake. So I had to, even though my stuff was put away, I had to get back out and make a milkshake. Why? Because he was a VIP. Even though I was annoyed, okay, because I wanted to go home. But that's for a milkshake. We're not to apply the same metric to people when it comes to their health. That's basically equivalent of me going in there, about to go into septic shock, and then Dr. J coming in there with a headache and a low-grade fever, which you could take some Tylenol for, and then you guys are like, oh, no, we got to treat him first. What? Are you kidding me right now? And so when I say nationalize the entire healthcare system, I'm not just talking about making a single-payer healthcare. No, baby. I'm talking about nationalizing the healthcare system, basically meaning you nationalize the hospitals, clinics, medical device manufacturers. You nationalize the nursing homes. Hell, I'm for nationalizing gyms. Yup. Rehab facilities, all of that. Because here's the problem. These things are necessary for us. And if it's necessary for us, then guess what? That means we need it to survive. And so these facilities are charging up the wazoo, even if it was single payer. They'd be charging our government up the wazoo for these things. These medical device manufacturers charging like crazy for some of these things. These electric chairs, these wheelchairs. You have some of them that are charging up the wazoo for CPAP machines. They're charging you like crazy. The pharmaceutical companies charging you like crazy for insulin, like I just talked about earlier. So this is why I say nationalize it all. because it should not be for profit. Because people are literally suffering. And hospitals do the same thing. And so now you got these board of trustees, you got these people on the hospital boards that want to prioritize the rich people over and ahead of people that are poor. Basically saying that because they have more money, because they may have exploited people more, they get more priority over you, even though you're more sicker. That's wild, man. That's wild. Let me go to the chat really quick. Creative Experiment says, we're getting shut down from money in the waiting room. Yeah. And yes, Jenna, this is very gross. Raziel says, you get shut down for money everywhere doing anything. Yes. J. O. Towner says, Canada is offering patients euthanasia if their treatment is deemed too expensive. No, I'm not kidding. Yes, I actually saw articles on this. In Canada, they're saying, well, look, if your treatments are too expensive, then guess what? You can just die. We'll help you do that. They're willing to help you die if you can't afford it. Make that make sense. Why? Why are we allowing this? This is what I was talking about, that young lady that said in the beginning. This is political torture. There is no life, liberty, and the pursuit of happiness for everyone. There isn't. So for someone to say, oh, this is the freest country in the world. No, it's not. It's not. Raziel, wonderful point. You are not supposed to be poor. That is why the earth is abundant. You are poor because of someone else's greed. There's enough food to feed everybody abundantly on this nation. There's enough water to give everyone in this nation. We could literally end homelessness today. You know how much it costs to end homelessness? 20 billion. 20 billion. Elon bought Twitter for 44 billion. Elon could have ended homelessness twice. Twice. Ilhanar says billionaires live in heaven now while we roast in hell on earth. They created religion and identity politics is the billionaires' tool of division. Bryce Smith says, how much crap do they need to be making so much money? Jayberg says we evolved as nomadic egalitarians who did not value materialism. Nadia says type 1 diabetics' deaths from being deprived of insulin aren't recorded in clear ways. That's sad. That is very sad. Eric, hey, good to see you. Eric says we can all have nice things. And hi, good afternoon. Yeah. Lee Lemon says billionaires can't help. A parasite cannot help its host. It can only feed on it. Yeah, absolutely. And I'll be getting out of here in a second, but I've got one more. Shout out to Indy Left, who's also in the channel on Rockfin. Love you too, Indy. Good to see you. Y'all subscribe to Indy Left. Indy Left, they are doing great things. They have some really great topics. I was actually on their show last Tuesday evening. Well, it went live last Wednesday, but I was with Reef and Colin. It was a really great conversation. So if you guys are not subscribed to Indy Left, they're almost to 1,000 subs. Give them a sub. They're really great, by the way. So good to see you. So yeah, that's what's happening.